once again, we sincerely apologize that we're not able to meet the 11:30 time as earlier advised. However, thank you so much for joining us. These are the times we are living in, the times of masks. Corona is here and it is real. And it is very important that we all work together in an effort to actually defeat Corona. One of the important issues to observe is that we must not stigmatize the disease. It is very important that we continue to show care, to show concern for those who might be infected, for those who might suspect that they are infected. And it is important that we allow the medical practitioners to continue to observe their ethics as they deal with patients and potential patients of Corona. And also it is just kind to be able to allow those who are patients and possible patients the privacy they deserve at all times, and especially during this time. I think let us not focus on fighting each other. Let us focus on fighting Corona as a disease. And I think for my colleagues in the media, you are part of the front line. We have to observe our ethics as well. We have to report about Corona in the best professional manner, and we must continue to observe citizens' privacy, as well as to respect the other group of workers who are in the front line, and these are the health workers who also have to observe their ethics. With that said, I do want to emphasize that this is the point to hold hands and fight together. Allow me now to hand you over to Dr. Chilufya, who's going to give us the brief for today.
Good afternoon, countrymen and women, and members of the press. And I do recognize our colleague Cabinet Minister Honorable Doris Leah, and our permanent secretaries in the Ministry of Health and in the Ministry of Information and Broadcasting, and our cooperating partners that have joined us today. Allow me to update you on the current status of the COVID-19 outbreak nationally and globally. I am saddened to report that we have lost one of our COVID-19 patients. The said patient had an underlying chronic respiratory disorder and a history of travel to South Africa and contact with some cohorts that traveled to COVID high-risk countries. Prior to his admission to our isolation facility on testing for COVID-19, he had been receiving care at a private medical facility in Lusaka. All his contacts have been followed up and were negative. The deceased patient stayed in our facility for 6 days, during which time he received advanced specialist treatment and support. Unfortunately, he succumbed to death in the early hours of this morning, about 02 a.m. May his soul rest in peace, and may I invite all of us in here to observe a moment of silence in his honor. May his soul rest in peace. In the last 24 hours, we carried out 160 tests, and out of these, we have confirmed 3 new cases of COVID-19, and all the 3 cases are secondary contacts to 2 separate COVID-19 confirmed cases, providing further information and evidence that local person-to-person transmission is now occurring in our communities. Cumulatively, that brings Zambia's COVID-19 cases to 39. This is out of the 752 individuals that we have tested by end of yesterday. All the cases that have tested positive are under our care in our isolation facilities. We continue to monitor and trace all contacts, and we continue to respond to alerts. As we get alerts, I would like to emphasize what Minister Information has said, that let us ensure that we protect the rights of these suspects and patients as we carry out our work in the media. A total of 936,841 cases of COVID-19 have been recorded globally, and the death toll has risen to 47,263. 50 countries in Africa have now recorded a cumulative total of 6,726 cases of COVID-19, with 230 deaths. A total of 194,599 individuals have so far recovered from the disease globally. Now, as the evidence of local transmission of person to person increases, our strategies and interventions need refining. Our levels of responsibility heightened. Our commitment to the measures as announced by His Excellency, the President of the Republic of Zambia, Dr. Edgar Chagwa, in his address, need to be complied with. The measures that have been prescribed in the Public Health Act, statutory provisions 21 and 22, need to be adhered to. We're increasing capacity in risk communication to reach all levels of society, and we are now engaged in training of leaders of certain peculiar demographics, such as marketeers and commuters associations, on COVID-19 awareness messaging. We appreciate the response we're getting from them. It is gratifying to note that a number of public transporters have put in place infection prevention measures on their conveyances, and furthermore are running communication messages that sensitize the public as they travel. We also note and appreciate those who have scaled down the number of people that ride on their passenger vehicles. This is commendable, as it promotes the social distancing that is so required to avoid person-to-person transmission. We urge the others to emulate. And as we urge the others to emulate, we urge non-essential travel to be avoided completely. And we'll repeat, stay home. We are deeply concerned with the state of certain public places, such as markets and other trading places, where waste management, sanitation and hygiene measures are inadequate. And we also note that continued crowding and non-observance of social distancing practices in such places. I wish to urge all market managers to ensure immediate implementation of the prescribed trading standards and hygiene requirements, failure to which they shall be closed. The law provides adequately for closure of any place that is described in the judgment of the authorized officer as an affected place. So, authorized officers who anchor on the Public Health Act, Statutory Instrument 21 and 22, to ensure that they protect the bigger population from the risk of COVID-19. It is for this reason that we urge personal responsibility, collective responsibility, and comply. Enforcement shall be enhanced, working with our colleagues in security wings enforcement to protect the greater public from this transmission shall be enhanced. So if you are trading or applying anything you're doing in a place that is not conducive and you're not observing social distancing, then you run the risk of being closed down. We value the partnership with the media fraternity in enhancing awareness and dissemination of information to the general public. We have noted with concern that a few media houses have been breaching ethics and respect for the privacy and rights of individuals. We're saddened by reports of media personnel pursuing some of the COVID-19 affected individuals in the privacy of their homes and families, you are equally at risk as you do that. Apart from breaching the ethics, apart from breaching the privacy of the patients. Even in this outbreak, patients continue to have their rights. I appeal to regulatory authorities and law enforcement agencies to address this, because it may cause a situation where people start reporting alerts to authorities for fear of putting whoever they report for under the spotlight. The call center for public information and alerts has been further expanded with additional equipment installed and training underway for 15 extra volunteers. Total capacity in our call center now stands at 37. The number of contact tracing teams in Lusaka, which I emphasize is the epicenter, has been increased at sub-district level. And you see a lot of activity in the various jurisdictions and increased testing to ensure that we pick up any positives and isolate them. It is for this reason I reiterate my call. From a public health perspective, Lusaka being the epicenter, act in solidarity, stay away from the epicenter, stay disease-free, and do not go and start a new focus of infection where you're coming from. Let us be responsible and not engage in non-essential travel. Stay home. And for those who have been debating about mass gatherings, public gatherings, various sporting events, I reiterate that mass gatherings remain banned. Mass gatherings remain banned, and if you must engage in any activity, apply for authority from the Public Health Institute, and it shall be assessed. The guiding principle is that we do not want any mass gatherings, whether they are sporting events, whether they are church gatherings, funerals. We do not want any mass gatherings that are outside the guidelines that have been provided in the national address by the President and the public health rules that are provided for under the Public Health Act. Countrymen and women, let us ensure we heighten use of masks, and let us ensure that we use masks that we can afford. There are masks that are made of cloth that are actually reusable. Some are on sale, some you can make at home. Protecting yourself from the next person who is affected or from the environment is extremely important. Masks do not need only these masks that we're putting on here. You can make reusable masks out of cloth and engage our teams in the communities to support you on that. Let us wear masks. Number two, let us remember that in places where we allow pores, where we allow objects, where we allow particles, where we allow particles that will have the virus or the droplets settle on, in places that are not clean enough, such that will have particles, settle droplets, we will be promoting transmission. It is the reason why we are saying let there be thorough cleaning of our environments. Let there be thorough cleaning of our environments. Countrymen and women, we're on the right track in controlling COVID-19 outbreak. Let us not relent in implementing all the measures that have been guided. To avoid a flare-up, let us stick within what we have been guiding. It is possible to be where we are today and not have a deterioration. It is possible to have a flare-up if we do not abide to the rules as we talk about them. Thank you.
Thank you very much, Dr. Chiluka. Very sad day indeed for Zambia, reporting the first death due to the coronavirus. And I think that the message is loud and clear. We are on red alert, we're in emergency. Corona is here. And the big message is that we each have to take personal responsibility to save not only ourselves, but our family, the ones we love, and the nation at large. Let's go straight into questions, please. Questions? Yes, please. You can speak up quickly, maybe use the microphone.
Good afternoon, Honorable Ministers. My name is Sharon from the Council of DC.
Try and speak up, my lady, Sharon.
It has been noted that there's a shortage of some grants on the market. And just wanted to find out, could this be due to the lockdown in the major exporter, India? And then what is the way forward?
Which drugs are in short supply?
Yes, which drugs?
There was one who was looking for a thinning drug, aspirin, and then also for diabetes.
So, do we have a shortage of drugs in
We do
Zambia?
not have a shortage of essential medicines. We will continue to collaborate with our partners locally and abroad to ensure that the supply chain remains patent. Yes, it is true that with the international lockdown on travel, there will be disruption in supply chains. We are not yet affected in terms of the supply chain, but this is the essence of planning, and this is the essence of being proactive in a situation as we find ourselves today. So we will ensure that there is patents in the supply chain for essential medicines in Zambia.
Next question. Yes, please.
Good afternoon, Honorable Minister. Darius from Diamond Series. Honorable Minister, in your earlier statements, you have been indicating to us that Lusaka is now an epicenter, of course, with the more than 24 cases being recorded. And we asked whether government is contemplating on imposing a lockdown just in Lusaka so that we don't spread the virus. And then can you also be able to tell us the 3 new cases that we have recorded, where are these people coming from?
For the purposes of the public, the question is, would government contemplate a lockdown of Lusaka as the epicenter? And secondly, the 3 new cases. Are these new cases, are they imported cases, or are they second generation cases?
We are executing a scalable plan under the guidance of the President, as he said in his address, and as evidence is presented and as the epidemic evolves, there will be measures that will be introduced to scale up our response. And therefore, the measures we do announce on a daily basis, measure up to the state of the epidemic. However, I have said repeatedly, Lusaka is the epicenter, yes, and act in solidarity with the next person, and don't leave and don't come to serve.
And the 3 patients, are these new cases?
These are all contacts of these are all third generation, second or third generation contacts of people that travel to COVID high-risk countries. And so what we are saying here is that we have a couple. One was working for a contact of a person who traveled to a COVID risk country, and that person transmitted to the spouse. They all stay in one compound. So that's those 2. Then the third one is a pharmacist who worked with the one of the doctors who we said was positive.
Next question. Yes, Diamond TV.
We saw news in one of the governments where it has been reported that 10 doctors amongst the people that have been tested positive COVID-19. Would you confirm to us that's the correct figure, or will we have more?
Well, I would be happy if colleagues, you got the other side of the story before you publish, and it is important in communication to balance your stories. I do not think that you should only be getting stories from informers and go out and publish, because we don't have those statistics. So I urge factfulness, and we keep an open door policy. If you hear what you hear, come engage with us. We are transparent. We've told you one of our doctors did contract it by were interacting with people who traveled from a COVID high-risk country who was treating privately, And that's how the pharmacists got it too. So we're transparent about this. So let us not alarm the public, or let us not misinform the public. Let's ensure that we engage. Should there be more health workers who will contract this, who come on this same platform and inform the public?
I think it's very important that the public understands that the question was a rumor out there about 10 doctors. There can't be rumors out there because the Minister of Health has been giving daily press briefs. And it's been very clear from the beginning the origins of this disease into Zambia, the first 2 cases imported from a visit to Europe, and thereafter the group that traveled on a trip to Pakistan. And thereafter, the minister has been very clear on the 2nd and 3rd generation contact, that it was a doctor and then now a pharmacist who worked with that doctor, and then there was a driver who also came into contact with people who had traveled, and there was a domestic worker who came into contact with those people who have traveled. I want to emphasize this point. What would be the benefit of Dr. Chilufya, or government in general, not sharing information with the public? No one wins. We are in red alert. And then secondly, it's not even about who is sick. We should all be concerned about the numbers. How many are sick? Because that's the only way we can be protected, if the numbers are less. So if we focus on who is sick, we're not going to get anywhere. And I think the minister here is trying very hard to share with us that each is a case, whether it's a doctor who is sick, it's a politician who is sick, it's a child who is sick. Our worry is the numbers. The more we have numbers, the easier it is for it to spread, and then no one is safe. And I think my colleagues in the media, we all have to work together and stay focused on fighting this disease. Any other question? Yes, my lady from WC, I believe.
The first question is, do private hospitals have the capacity to detect and act on the COVID-19? Also, what treatment are you giving those who are positive? The other question is, neighbors reject COVID-19 screening center. This is in relation to the Victoria Hospital. I'd just like you to shed more light on these 3 issues.
Well, thank you very much. First of all, we are dealing with a novel coronavirus. It's a new virus under the coronavirus family. And this COVID-19 virus, we've only developed methods to detect it recently. We are using reagents, and we're using equipment at the University Teaching Hospital Virology Laboratory and at the UNZA School of Veterinary Medicine. We are establishing capacity at the Ndola TDRC, Ndola-based TDRC, and with technology evolving, the test kits that will be rolled out in the next week or 2 that will demand less of the most of the sophisticated gadgets, such that we'll be able to test in many, many places with lesser sophistication in terms of equipment. So the private facilities as we speak today are not providing testing for COVID-19. And we are testing for COVID-19 in the 2 places I've said, and the 3rd one, which is commencing today or tomorrow, at the Ndola TDRC. And as we introduce more testing sites, we will announce. As capacity is built in private facilities, we will equally announce. But we do not want to mislead the public that this service is where it isn't. We have set up an incident management system, and we've set up places where people must be seen. I must use this opportunity to emphasize, if you don't feel well, our advice is pick up the phone, call one of those numbers to guide you. We'll also publicize screening centers so that you don't just go to every facility.
So tests only in Lusaka in 2 places, UTH and the University of Zambia, and another one soon in the Copperbelt. That is all. What about the treatment? What treatment are the patients getting? That was the second question.
Well, let us remember that it is on record that coronavirus, the novel coronavirus called COVID-19, does not have a vaccine or cure that carries efficacy, or drug that carries efficacy. Therefore, today, what we are using is what we call symptomatic treatment, where we manage the symptoms of the patient. So we do symptomatic therapy, and that's how we manage our clients. Should they go into distress, requiring ventilation, we'll give oxygen support through either nasal catheters or even ventilators. Should they go into kidney failure, we will support renal function using the various methods that we use to support renal function. So we support them symptomatically and support the patients as the symptoms arise. This is called symptomatic management.
Okay, so to be clear for the public, Dr. Chulufia, since corona has headache, you treat for headache. Somebody is coughing, you treat for coughing. Somebody has sore throat, you treat for sore throat. But there is no cure for coronavirus.
Yes, for those who
So
didn't
many
get
of
me
us are
right,
not doctors.
at the moment, while research is ongoing for a cure and a vaccine, at the moment, we don't have any definitive drug to cure coronavirus, COVID-19, or any definitive vaccine to protect you, from it. Research is raging, research is ongoing, and there are many drugs that are being researched over. Now leave it at that.
Okay. And the last question was that the residents of the area where there's Victoria Hospital are a bit concerned for it to be used as a place for keeping patients who are corona positive.
We want to assure you that wherever we have cited a facility for isolation or for management, we've taken into consideration all the variables, including the safety of the people around. We will act responsibly, and we have a highly trained technical team that will set up places where we manage those who are symptomatic and that require intensive management at particular facilities. We'll set up those who are asymptomatic but yet are positive in places where there will be less demand for sophisticated tertiary care, and we'll set up isolation facilities for those who may be symptomatic and are still under investigation. We have various facilities graded in that manner. So we will not put anybody at risk when we identify any facility. We'll be the first ones to know that we're putting people at risk by putting people at a particular facility. So the people of Victoria are safe.
Okay. Maybe before I go to the audience again, we keep getting one question on our platform in information, and that is corona an airborne disease? What is the difference with the droplets? Maybe can you explain that to Zambia, to the nation, Doctor?
Well, when you cough out, when you sneeze out, you're releasing droplets. Those droplets could have the COVID-19, and when others inhale them, you'll get it. So it's air through inhalation. But the droplets can also settle on surfaces. You touch those surfaces and you play around with your mouth and nose and you get them. Or you will be handshaking and passing on those droplets to the next person who will do that. This is the reason why we're saying in places where sanitation is poor, with too many particles and everywhere, you will have a problem, because this can settle on many surfaces, including particles. This is the reason why we are calling for major cleaning, so that we do not have any dirt in our areas where we're operating from.
Any other questions from the media? Well, I think that it was very loud and clear. Today, Zambia has recorded its first death in terms of the corona virus. The call for personal hygiene has been heightened by the Minister of Health. We all need to take responsibility so that we can actually look after our families. And our call to our colleagues in the media is that, like the health staff who are in the front line, the media is also in the front line, and it is important that we observe the highest level of professionalism as we report about corona, so that we do not abuse the privacy of individuals who might be positive, but also indeed who might be potentially positive. I think the message also has been that let us stop loitering. We should stay at home if we have nothing else to do anywhere. We should ensure that we observe social distancing. We have to ensure that we avoid gatherings at all costs. That's the only way to stay safe. In fact, it is the family. At family level, you should be thinking of a lockdown at family level. The Minister of Health is encouraging, and government in general, that let us stay away from public places. And if we must go, then at least let one person be able to go. And I think that we have to continue to call upon the private sector who have been supporting us, that please continue to work with government. Yes, we need test kits now, we need gloves now, we need masks now. But we must also anticipate that we might need food bags, we might need all kinds of support. We might have to take retail services where the people are so that we reduce movement of people. These are issues that should begin to push the private sector to some sort of reaction, because government can't do this alone. The people of Zambia can't do this alone. We all need to work together. And I'm aware that we still continue to get support, and I think that the Permanent Secretary in the Ministry of Health is going to speak to that.
Thank you, Honorable. Ladies and gentlemen, in solidarity with the government of the Republic of Zambia, corporates have continued to support the Ministry of Health in the ferocious fight against COVID-19. Today, we have a total of 4 corporates who are making donations. And before I invite them, I wish to express our gratitude to Stand With Back, who have not come today to present their donation, but I wish to confirm that they have today donated 3 ventilators in the support of COVID-19. So I now invite World Vision to come forward.
World Vision, are you here? Maybe what's the next one?
The Lebanese community.
Please, you can come through this way.
Thank you.
That is a representative of the Lebanese community. Chairman. Chairman of the Lebanese community.
Honorable Minister of Health, Dr. Vishkalo Chilupia, Honorable Minister of Information, Dora Lia, PSL Health and Information, members of the press, ladies and gentlemen, good afternoon to you all. Let me begin by taking this opportunity, thanking the ministers for giving me this opportunity to be here with you today, to show our solidarities and to show you that we are with you in good, in bad, in ugly. We are with the people of Zambia. I must commend you, honorable ministers, for the wonderful job you're doing. You are really fighters. You're fighting an unseen enemy, but you will reach somewhere. We as Lebanese community in Zambia felt obliged that in these circumstances, we really have to come up and be with you as people of Zambia. Therefore, we have decided to begin by donating 1,200 bags of 25 kg mealie meal for the people of Lusaka. And let me assure His Excellency, the President of the Republic of Zambia, the people of Zambia, through you, honorable ministers, that we shall be there with you. We will try our best, doing whatever we can, in any way we can, to support you. working hands in hands, but obviously without shaking hands. Shoulders to shoulders, we will be able to defeat that ugly enemy. And God bless you, God bless Zambia.
Thank you. I now invite HPCZ.
We acknowledge service of the Honorable Minister of Health, Dr. Zambia, the Honorable Minister of Information and Broadcasting, Madam Barasiria, Permanent Secretary, Secretaries from Ministry of Health, and the Permanent Secretary from Ministry of Broadcasting and Information. Honorable Minister, the Health Professions Council of Zambia recognizes the proactive steps that you have taken coronavirus. We further realize that government needs support from all of us in various ways that we can. As HPCZ, we take up this opportunity to reiterate government's recognition of the health workers in the fight against this pandemic. It is in this vein that HPCZ would like to make a contribution of 200,000 to go towards the fight against this pandemic. Honorable Ministers, we cannot ignore the fact that health workers are facing an unprecedented workload in the health facilities, and that is why we must do everything possible to support them. We want to commend government and His Excellency the President of the Republic of Zambia, Dr. Edgar Chapalungu, for resolving to recruit 400 doctors, and in addition, 3,000 other health workers. This, Honorable Minister, will ensure that it will relieve the health workers who are already under stress. We are grateful, Honorable, to be accorded this opportunity to partner with government and contribute towards the cause of COVID-2019. Thank you.
Honorable Ministers, the presentation of the donations shall be done from outside.
Thank you so much, Zambia. I think this brings us to the end of today's press brief, but let us just remember, to be safe, stay at home. To be safe, please keep social distancing. And we in the Ministry of Information and Broadcasting, Minister, you may wish to know, we are heightening our work with the Ministry of Health to ensure that we continue to provide sensitization information materials, especially in public places. Please let us remember to be kind to each other. This is the time to show kindness, and let us keep praying for the health workers who are risking their lives each day. Thank you very much.